All right, welcome everybody. Glad to have you with us today. I'm going to just give a couple extra minutes for a few more people to show up for this. So in the meantime, let me just kind of go through some of the ground rules and then we'll get started. Okay, first thing, we are taking questions and giving answers. So use the chat box on the screen and submit any of your questions. We'll try to answer as many as we can in the broadcast, but if we don't, we'll definitely get back to you a little bit later. Now, also, I need to just let everybody know this plan at this moment is for Ontario members only. So apologies to the rest, but your turn is coming. And I just used the word member. Let me just describe that as well. I mean, you must be a NEWBI community member. All right, I think that covers everything. And just to be knowing that your time is important, let us get started. So everybody, my name is Bob McLean. I am the head guy at newbisystem.com, and I'm absolutely pumped today to be able to tell you all about our latest member benefit, our group insurance program. So I've invited Gary Schneider to come and talk to you today. He is the independent financial broker behind all of this program, and he is one of our preferred providers. Now, I've kind of beat up Gary a little bit in putting this program together because I had some pretty lofty objectives in what I want to see in this program, and he has come through with flying colors. Now, I've introduced him as a financial broker because he does do insurance, but you're going to see as we go through, he's got a much wider perspective than just the insurance program itself. So, having said all of that, welcome, Gary, and thank you for being here.
Well, thanks, Bob. So, Bob, when you and I were talking about the program, and like you said, you were putting my feet over the fire to put a very aggressive program together, we made a list of 12 points that needed to be covered off for your members specifically, and we referred to that as the 12-point benchmark of excellence. And that information can be found on the website, all 12 points. So I'm not going to belabor each and every point. But there were some key areas which are absolutely essential to get completed as part of the presentation of the package. And you were adamant that this had to be affordable. That meant it had to be affordable at the entry level for someone who was just a startup business and wanted some kind of healthcare plan. They needed easy access where price wasn't going to rule them out of the market. It also had to be scalable. So that meant that regardless of what people wanted in their plan, this wasn't going to be a one-size-fits solution where they were tied to it. They could start with something that was at the lower end, just sufficient, but could be scalable to adapt to their actual need for healthcare coverage. In addition, it had to grow with the organization, and it didn't have to fit just the plan for one individual. It might be for 2 people or 3 people or 10 people or 100 people. So you were looking at something that had to be affordable and scalable. And most importantly, it had to be inclusive because you don't have second-class members. You wanted all your members that were eligible to participate in this particular plan to have access to it. And as we've discussed in the past, in a typical situation, under most standard plans, you can be excluded based on the nature of the industry that you're working or the nature of your occupation or a combination of the two. So there's some industries, they cannot get healthcare plans at all because they're in high-risk occupations. And not knowing exactly what each and every member necessarily wants to do in their own enterprise, you were very clear that regardless of what they were doing, they had to be able to access healthcare coverage. And so that's included as well. So I'd first like to start off explaining some of the value of having a healthcare plan because people are frankly asking, well, what's in it for me? Why do I really care? I rarely get sick, or I may not take advantage of the medication or drug plans. I'm not really sure that this is something that I may fully exploit. What's the point of it all? Why should I even get a healthcare plan? And so first, right from the start, I'd like to talk about the fact that there's tremendous tax savings opportunities in having a healthcare plan. And the reason that that's particularly important is because as a business person, taxes have the greatest negative impact to your bottom line. You work hard, you take the risk, you incur the expenses of running an organization, you have a profit, and lo and behold, along comes a tax man, takes a line share away from you, and you're left holding very little. So if there's a way that you can trim your taxes, and if you can do it significantly, you're probably going to be interested. Would you be interested, Bob?
There we go. Sorry, I'd muted myself there, but absolutely yes. Definitely interested in those tax savings.
So that's an important factor of having a healthcare plan. That's an enormous benefit. I'll walk through some examples in a moment. I want to talk about the fact that it actually has increased buying power. So even though you save money, well, what does that mean, saving on taxes? It means that your bottom line is actually becoming more powerful. I'm going to show you an example where the buying power actually increases tremendously for individuals that are involved in a healthcare plan. Healthcare plans are a great apparatus for providing business acceleration. I'll get into that in just a little bit more in a moment, but really what we're talking about here is that it actually can help your business launch faster and stronger. It provides a venue for it to grow more aggressively than it can without a healthcare plan. So that means more profit, more to your bottom line. And lastly, it's really instrumental in a mechanism as part of your succession plan. At some point down the road, you should be planning to sell your business, whether it's to retire or because you're perhaps a serial entrepreneur, you're going from one business story to another, and you want to take your profits, you want to capture them, take the wealth from that particular business and move on to the next venture. Well, all of that doesn't happen unless you actually plan to sell your business. And one of the mechanisms that's in your favor is a healthcare plan. So let's examine some of the impacts. When we have $1 and we spend 20% of that on taxes, we're left with 80 cents in our pocket. So our actual buying power from the $1 that we made from our company is only 80 cents. It's unfortunate, but taxes are a part of our life. Now, if we increase the tax bracket from 20% to 40%, that $1 of earnings from our business translates to only 60 cents that's left in our pocket. So where does that happen? Well, it happens because the tax system isn't fair. The tax system effectively punishes you for making more money. So the more money you earn, the more you pay in taxes because you're pushed upwards into a higher tax bracket. So every $1 that you make becomes less and less as you start earning money. In this case here, we've seen that a 20% differential in the tax bracket, so we're increasing the taxes from a 20% tax rate to 40% tax rate, actually reduces your buying power by 25%. It's not proportional. You're actually ending up with less money proportionally, even though the tax bracket has gone up 40%. Your buying power is diminishing. And your buying power is a reflection of your wealth. This is the stuff you use to buy things, to have a lifestyle with. And it's going down because the taxman has incurred this type of scheme for taxing their citizens. So taxation, we know that the more you make, the less you actually get to keep of those earnings. The advantage of having a healthcare plan is the more you make, the more you actually get to keep. And here's why. A healthcare plan is fully deductible to the business. It's 100% write-off to the business. And here's the kicker. It is not taxable in the hands of the member. That means the person who's getting the value of those benefits from the healthcare plan isn't being taxed on the dollar value. It effectively bypasses taxation. Now you might be thinking, well, this is crazy. This has got to be some sort of loophole they're trying to cover up. But it's not. It's actually built into the Tax Act. There's a provision written into the Tax Act that provides for this. It's not a loophole. It's actually a provision. So if you're not taking advantage of a provision that's in the Tax Act that allows you to reduce your taxes legally, then you're not taking full opportunity of your wealth within your organization. You're trying to build wealth by running a company. Why not take the most out of it? Exploit the wealth, exploit the opportunities that are currently available in the Tax Act. Your healthcare plan is one of those mechanisms. So we're going to look at a case of Peter. Now, Peter is a proprietor. He's not a fancy corporation. He's not even registered. He's just Peter. And he operates a business. It's not a fancy business. It's not run by computers. In fact, Peter basically uses a checkbooks, and he has a shoebox where he stuffs his receipt. At the end of the year, he figures out his taxes. Very simple operation. But Peter does fairly well. His business nets him $100,000 a year. But he doesn't have a health care plan. Maybe that's not important. Maybe it is. We're about to find out. His taxable income from his business is therefore $100,000. Unfortunately, that puts Peter in a very high tax bracket. He'll be paying $43,000 in taxes on the taxable income, which leaves him with only $56,000 in after-tax dollars. Remember, this is $56,000 in take-home pay. Now, he has some family needs he has to address. He's got some healthcare needs. Now, during the year, his family, on average, spends approximately $1,000 on prescription drugs, dental care, vision care, chiropractic care, that sort of thing. But he's got a son with a disability, and he spends about $800 a month in expenses related to his son's disability, which adds up to about $10,000 a year. He also just found out that his daughter needs braces. Orthodontic care are going to cost him $4,000 this year. So in total, he's looking at a bill of about $15,000 just for his family health care needs. We're going to look at his buying power. Remember that after taxes, Peter's take-home pay was only $56,000. He's got $15,000 of foreseeable health care expenses. That means that after he's paid the $15,000, he's left with $41,000 to pay his mortgage, his car lease payments, his hydro, his utility, his cell phone bill, all of it. All the facts of life. $41,000 left over. That's his true buying power. Now we're going to look at a case where Peter actually gets a healthcare account. He's still a sole proprietor, still has $100,000 that he nets from his business, but this time he's taking the deduction. He's got a plan in place. He's spending $17,000 on his plan. It reduces his taxable income down to $82,000, which dramatically lowers his tax bracket from 43% down to 35%, leaving him with $53,000 in after-tax dollars. His buying power, again, his $53,000 is his take-home pay. He's got no out-of-pocket healthcare expenses because all his healthcare expenses were covered under his group plan. That means that the take-home pay that he had, he still has. He's still got the $53,000 in after-tax dollars compared to his previous situation. He has increased buying power. So if we take a snapshot of Peter's situation and run down to the bottom of the table, we quickly see that without a plan, his buying power is $41,000. This is the money he has left over, the residual money he has left over to cover off his living expenses. But with a plan, because of the tax savings, because of the deductibility, and the fact that his healthcare benefits are not being taxed in his hands, he actually ends up with $53,000 in his pocket. That's a $12,000 savings. He's just increased his buying power by almost 30%. The cost to him was simply passed from his personal expenses to his corporate expenses. In this case, he was a proprietor. He could still get the plan even as a proprietor, didn't have to be incorporated, but he still got the full deduction. Now we're going to have a look at a second case, but someone who's not an owner. In this case, we're looking at Barb, who may or may not decide to come on board as an employee. So Peter was looking for an assistant. He wanted to hire an assistant to take care of marketing, book his client appointments, do some admin work, some bookkeeping. And he had a conversation with Barb, interviewed Barb, and decided she's the person for the job. He offered her $65,000. But Barb said, you know, you're right on the button there, Peter. That's pretty much what the market will pay. In fact, I just had a conversation, an interview yesterday, where I'm being offered exactly the same amount by one of your competitors. So now Peter's a little concerned. He may not be able to sway Barb over. So Barb's a little concerned, and she's thinking, well, how do I make a decision here? This is really difficult. And during the conversation, it comes up that her husband requires full-time nursing care, and she's spending about $800 a month on his nursing care. That translates to almost $22,000 a year that Barb has to pay for because the province doesn't cover it. This gives Peter a perfect opportunity to change his approach. So rather than offer her the $65,000 a year as cash compensation, he sets it out as follows. He says, Barb, I'm going to pay you $40,000 in cash as part of your compensation, and I'd like to pay you the balance, another $21,600 in benefits. The $21,000 will cover off your healthcare needs for your husband, his nursing care needs for the year. Now, I realize that the total compensation to you will only be $61,000. We do the math, and it doesn't compare directly with the other person who's prepared to offer you $65,000 in cash. But bear with me. There is a point to my madness here. If you take the competition at $65,000, you'll be in a tax bracket of about 31%. You'll be paying $20,000 in taxes, meaning that your take-home pay will actually only be $44,000. From that, from your take-home pay, you've still got to pay those nursing care expenses. So after everything is said and done, you're left with a buying power of only $23,000. But if you follow my route, your taxable earnings are only $40,000. That's because the $21,000 that you receive as a benefit under your plan is not taxable. This reduces your tax bracket down to about 18%. You'll only be paying $8,000 in taxes. This leaves you with a net take-home pay of $35,000. And since your healthcare costs were covered, you've got no out-of-pocket coverage expenses for those expenses. That means your additional buying power. Sorry, that's thrown me. We're not able to splice this.